wish to speak, especially during the questions and answer session. Use the chat feature for relevant questions or comments. Questions can also be submitted in the chat to ensure they are addressed during the session. Be punctual and respect the agenda. Ladies and gentlemen, latecomers are encouraged to just follow along quietly without disrupting the session as much as you can. The attendance register will be shared every 15 minutes during this session. It will be shared at 6:30 p.m., 6:45 p.m., 7 p.m., and 7:15 p.m., and it will automatically close at 7:30 p.m. So please ensure that your name is recorded accurately, your council registration number, as well as your email address to ensure that you obtain it. Be respectful towards the speaker and other participants. Inappropriate behavior or comments will not be tolerated, and we might have to just excuse you from the meeting. Okay. Can everyone hear me? I'm sorry, Dr. Anne, can you hear me? Just Pride, can you hear me?
Yes, I can.
Yes, we can hear you.
Okay, perfect. So I'm just going to quickly just share the register for those who have joined us. Just give me a second. Do this before I begin with commence with the introductions. Okay, so today's topic, evidence and insights on the impact of mindfulness, compassion, and gratitude interventions on mental health and well-being. Our speaker is Dr. Anne Sahlberg. She's an advocate for global health, blending clinical expertise with a passion for transforming adolescent HIV care and quality healthcare services in undeserved regions. With a medical degree from Lund University and a MSc in epidemiology from the London Institute of Hygiene and Tropical Medicine, Dr. Sahlberg has devoted her career to impactful healthcare initiatives across the region. Her work with Doctors Without Borders in Zimbabwe catalyzed improvements in cervical cancer screening, HIV treatment, and training for healthcare workers, while her contribution to Jvandiri assisted in scaling the innovative CATS program, which has empowered over 100,000 young people living with HIV across the region. A sought-after speaker and collaborator, she has presented on topics ranging from cervical cancer, screening to disclosure and viral load management. Now, as Senior Technical Advisor, Dr. Sahlberg guides healthcare teams across Africa, contributing to WHO's Thrive 95 framework and setting new standards for adolescent-centered HIV care. Thank you so much for volunteering to give this presentation today. We are honored to be in your presence, and you may commence and lead us through this. Thank you.
Thank you so much, and thank you so much for inviting me to talk about one of my favorite topics. Please confirm that you can see my screen.
Yes, I can see your screen. Kindly put it in presentation mode.
Somehow gotten. All right, now?
Yes, it's in presentation mode.
Perfect. So what I'm hoping to do today is to give you an overview of some of the existing research around mindfulness, gratitude, and compassion. It's a lot, so it's just a sample that I'm giving here. And then also I'm hoping to maybe get you a little bit interested in these interventions. So by the end, I'll also provide some resources of how to explore further for those that are interested. And yes, like said, I'm an HIV clinician. I've been working in Zimbabwe for the past 10 years, focusing specifically on adolescent health and working with a psychosocial support program through Jvandiri. But I've also worked as a general practitioner in Sweden. And of late, I've become a certified mindfulness teacher. So I'm a doctor at day and a mindfulness teacher at night. So how did I start my journey for this? So when I was a young person, I suffered from anxiety and depression. And it was during my medical studies that I first came in contact with mindfulness. And it was a series of mindfulness talks. One was mindfulness and depression, mindfulness and anxiety, mindfulness and addiction, and so forth. And I found those extremely helpful. And then I started attending retreats. And for those who don't know, retreats is when you come to a place and you meditate for a week, basically. And I found that very transformative, but it was more my own personal practice. Still remember when I started working as a general practitioner, and I would follow the interventions recommended in Sweden, which is basically psychotherapy and antidepressants. But I would still know that there were other things out there, I didn't feel quite confident in recommending them at the time. But then during COVID, my sister asked me to teach her meditation. And after a while, my mom also started wanting to learn. And that was the first time I realized that I could actually share this practice. And then I joined a mindfulness meditation teacher program with Tara Brack and Jack Cornfield. It's a 2-year online training. And then in February 2023, I became a certified mindfulness teacher and now started providing mindfulness courses and also retreats, both in Sweden and here in Zimbabwe. So that's my journey. So maybe just to start, what is mindfulness? John Kabat-Zinn said, mindfulness is the awareness that arises from paying attention in a particular way, on purpose, moment by moment, and non-judgmentally. So there are 3 things here. One is that we need to decide what we're paying attention on. It has to be in the present moment, and then that we're not judging. So who was John Kabat-Zinn? So he was similar to me, like a doctor and also a meditator who found that the meditation was very helpful. And then he worked at a hospital and he asked the doctors to refer all the most difficult patients to him. So the ones that had personality disorders, the ones that had pain that weren't resolving, the ones that were very unhappy with the care they were receiving, all of those patients that no one really wants. He said, please send them to me. And he took them down into the cellar and he started teaching them mindfulness. And he had amazing results, not in resolving their problems, but assisting them in how to live with their problems. So he then went on and he set up something called mindfulness-based stress reduction. And what he did was based on Buddhist practice, but he took away the religious part. He just took the part of it, which is basically mindfulness. So he took it and set up a secular course. And just to say the mindfulness practice, it's not just a practice of the Buddhist tradition, it's also part of Christianity and Muslim tradition of the mystic parts, like Sufism, for example. So while he's from a Tibetan or from a Buddhist background, this is not something that's just part of the Buddhist tradition. So he extracted and provided a secular training. And as you can see, it was an 8-week workshop conducted by certified trainers, consisting of weekly group meetings. So there was 2.5 hours each. And then they had a 1-day retreat, which was a 7-hour mindfulness practice between the last and the second last session. And then the participant also were assigned daily homework sessions of 45 minutes and instructed in 3 primary techniques. And that was mindfulness meditation. That's the one I was talking about before, to pay attention on purpose and in a particular way and non-judgmentally. Then body scanning. And body scanning is basically when you pay attention to all the parts of your body consecutively. So you start with your toes, moving up your feet, your legs, up your body, to your hands and face and so forth. And you do it very slowly. So you really pay attention to the body awareness, basically, and simple yoga postures. And part of this training is also group discussions and explorations of the meditation practice and its application to everyday life. So this is also very integral to the program. So why all this talk about mindfulness? Arianna Huffington said, what study after study show is that meditation and mindfulness training profoundly affects every aspect of our lives, our bodies, minds, physical health, and our emotional and spiritual well-being. It's not quite the fountain of youth, but it's pretty close. When you consider all the benefits of meditation, and more are being found every day, it's not an exaggeration to call meditation a miracle drug. And this is also what I'm hoping to convince you by the end of this presentation, and also my personal experience. I know we tend to focus on pharmacotherapy because we also have the pharmaceutical companies that are pushing that and providing funding for it. But all of these things have quite a strong effect, and it's important that we're also aware of them as medical practitioners. So what does research say about mindfulness? Dr. Stefan Hoffman worked at the Center for Anxiety and Behavioral Studies in Boston. He is a well-known behavioral therapist, and he was very critical of all the studies on mindfulness. So he set up to do a meta-analysis of the existing research. And he found 39 studies of patients with a variety of medical and psychiatric disorders. And what he could see was that there was a moderate effect size in improving anxiety and depressive symptoms. But for patients with anxiety and mood symptoms, the effect size was even larger. And the effect size was robust and maintained over time. There are similar meta-analytic reviews that have found similar things. As you can see, Goyal et al., they found also the improvements in anxiety and depression and pain. But there's also been people who have looked into how it affects those with chronic and life-threatening illnesses and oncology. And they see effectiveness in addressing psychological stresses and coping mechanisms, and improvements in mood and reduction and levels of stress. Lehrman et al. Also saw improvement of quality of life. Carlson and Garland saw reduction in fatigue and improvement in sleep. And Carlson also saw that you can use this for coping with rheumatoid arthritis, cardiovascular disease, diabetes, HIV/AIDS, very relevant in our settings, irritable bowel syndrome, and chronic pain. And in a meta-analytic review where they looked at patients that didn't have any medical or mental health diagnosis, they also saw that they've had a reduction in stress and anxiety and increased empathy. So even for the ones who are not unwell, mentally or physically, they also saw reported benefits of mindfulness. So these were all self-reported improvements. What can we see more objectively if we look on biomarkers? So Simon et al., as I'm sure we're all aware, chronic stress downregulates the immune system and it plays a role in cellular aging. So chronic stress can be very harmful. And Matusek, Dobkin, and Persner, they saw a reduction in cortisol levels after mindfulness practice. And there's one study that's quite interesting where they assigned healthy volunteers to the mindfulness-based stress reduction group or a waitlist control. And then they checked their electrical brain activity and also their immunological response to an influenza vaccine. And they saw two things. The first is that the MBSR group had significantly greater left anterior frontal lobe activation. So that's the one that shows positive mood as compared to the control group. And they also saw that they had a stronger response to influenza vaccine, which indicates that they had a better immune response. And similarly, other studies have found mindfulness practice to lower blood pressure and improve immunological biomarkers. But it's not just limited to biomarkers. We can also see changes in genomics and also how our genes are being expressed. So, for example, loneliness is thought to increase the genetic expression of pro-inflammatory genes. And Creswell et al., they did a random assignment of older lonely adults into a meditation intervention or a waitlist control. And they found that they're examining known markers of pro-inflammatory genes, both pre and post-treatment, and there was a clear relationship between the level of loneliness reported and genetic expression of pro-inflammatory genes. And meditation intervention experienced measurable epigenetic changes in the genome after 8 weeks of meditation training. Also, interestingly, as I'm sure many of you are aware, there's lots of interesting research around telomeres. So the telomeres, they are like the plastic on the tips of our shoelaces. They protect them from aging. They protect our genes from aging. Cognitive stress and constant rumination on potential threats creates a stressful environment that in turn can shorten the telomere length and contribute towards cellular aging. And mindfulness can have a beneficial impact on telomere length by reducing the cognitive stress and arousal that can affect cellular aging. So, for example, for Eppel and et al., they looked at 30 participants who spent 3 months in retreat as compared to a control group. And they saw a decrease in negative affectivity and other positive psychological changes, and that were linked to increased telomerase activity. But we can also see impacts of mindfulness on the brain directly by doing neuroimaging. So for example, Lazar et al., he looked at experienced meditators and saw that they had a cortical thickening in areas related to emotional, sensory, and cognitive processing as compared to non-meditators. Also for Tang and et al., they saw changes in the white matter or neural tract in the anterior cingulate, which is responsible for self-regulation after only 4 weeks of daily practice. So that's quite a short period of time. And Hölzel et al., they saw changes in the gray matter density or the actual number of brain cells in the hippocampus after 8 weeks of MBSR. So hippocampus is memory. And then Luder saw that experienced meditators had greater cell volumes in the right prefrontal cortex. So that's responsible for emotional regulation as compared to non-meditators. And also finally, some thoughts around mindfulness and rumination. So there was a Harvard team that installed an app on thousands of mobile phones that asked 3 questions. The first one is, what are you doing right now? Second one, what is your mind doing? And then how happy are you? And they found something that might not be so surprising to most of us, that a ruminative mind is an unhappy mind. Similarly to the Shona expressing kufungi sisa. The Shona expression for depression is thinking too much, which plays into this one. It's an apt description. So during an experiment comparing mindfulness and relaxation, participants were randomly assigned to a 1-month mindfulness training, relaxation training, or a control group. And they found that both the mindfulness group and the relaxation group had improved positive mood states compared to the control group. It was only the mindfulness group that showed decreases in distractions and ruminative thoughts. So it's not just a relaxation, it's more than that. And then finally, how is it with mindfulness and severe psychiatric conditions? So most of these studies, they excluded patients who had severe psychiatric conditions or that were suicidal. But a few actually looked at that in particular. And Serpa et al. Found that mindfulness intervention is effective at significantly reducing suicidal ideation. ABBA saw that mindfulness training is effective at managing negative symptoms among psychotic patients. And Corey found, and that was a review of 7 randomized controlled trials, significant reductions in negative symptoms, that's flat affect, lack of pleasure, and limited speech, and hospital readmissions among those that were psychotics. And finally, there was a randomized controlled trial on the PTSD that found that a mindfulness intervention could decrease the PTSD symptom scores as well as normalize the neuroendocrine markers that distinguish PTSD from other mental disorders. That's also quite interesting. So what does this all mean? There's a popular saying that cells that fire together wire together. Similar that when we go to the gym, we can practice and make sure that our arms and legs and stomach and butt and whatever we want to can become stronger. We can do the same for our brain. We can practice mindfulness. We can practice less rumination. And training the brain is like training any other muscle. You need to use it or lose it. So similar to mindfulness, we can do the same with gratitude. So let's just start with the definition of gratitude. Emmons et al. Said that gratitude has been conceptualized as an emotion, an attitude, a moral virtue, a habit, a personality trait, and a coping response. And it appears to be related to personality traits as well as subjective and moral well-being, according to McCullough et al. And then Sanson was saying that gratitude is a light expression, not necessarily conditioned to good times, making it possible to maintain the feeling and feel good even during negative experiences or most difficult moments. And I still remember many years ago when I was in Sweden talking to a friend of mine who was an immigrant from South America who had lived in Sweden for 2 years. And I asked him how he was doing, because I know it's tough to be an immigrant. And he said that he was grateful and that grateful is more important than being happy. And that really stuck with me. And that's also one of the reasons I become so interested in gratitude. And similar to that, as you can see, even during negative experience or difficult moments, gratitude can maintain the feeling of feeling good. So it's a very useful tool, not just for good times. So how do we measure gratitude? So McCullough et al., they have a gratitude questionnaire, 6-item form. You also have the gratitude resentment appreciation test, the GRAT. And they could see that the gratitude questionnaire in 6-item form was correlated positively with optimism, life satisfaction, hope, spirituality, religiosity, forgiveness, empathy, and pro-social behavior, and negatively with depression, anxiety, materialism, and envy. So how does gratitude affect self-reported symptoms? So this is a systemic review and meta-analysis by Dennis et al. From 2023. So there were 64 randomized clinical trials that were included, and they demonstrated that patients who underwent gratitude intervention experienced greater feelings of gratitude, better mental health, and fewer symptoms of anxiety and depression. And moreover, they experienced other benefits such as a more positive mood and emotions. And the interesting thing, and I think especially for an African context, but for all contexts, is that those interventions were quite simple. It didn't require for trained personnel to be delivering them, or for people with lots of training, like a psychologist, or it was just something simple as to do a diary where you write every day what you're grateful for, or stimulating the expression of gratitude toward another person verbally or in writing, posting pictures on social media with captions of gratitude, or encouraging the simple act of thinking about gratitude. So this is very easily applicable and accessible to most people. I was hosting a gratitude workshop recently and come across an article about when you write a letter of gratitude towards someone that you're close to, and that they could see even weeks afterwards that this had an impact on the people who did it, which made me very curious. So I tried it with my partner, and I just out of nowhere wrote him a letter of gratitude. And I still today, I can feel the impact of that. Like it did impact both. It does impact when someone show you gratitude, it impacts the relationship, and it also has a long-term impact. I also shared it with a colleague, and she got so inspired. She started writing a letter of gratitude towards her mom, towards her daughter, towards people who had cared for her when she was in difficult times. And I think it really goes well with Christian faith practice here, which is very much focused on gratitude. So encouraging gratitude exercise is very culturally appropriate, I would say. For this particular review, some of the strengths was that they managed to quantify outcomes and analyze the certainty of evidence. They also had outcomes of gratitude interventionally exclusively with control groups. And they also had a great diversity of participant characteristics. So they had teenagers, physicians, college students, prisoners, older adults, neuromuscular disease patients, and children with depressions. Some of the limitation was that there was a wide variety of different methodologies in the studies. They had a great diversity of different gratitude intervention. And in some studies, there was a lack of blinding, high loss to follow-up, and analysis by protocol instead of intention to treat. So what does this mean? Gacy Denise said the exercise of gratitude is considered a strong therapeutic tool for positive psychology in obtaining responses that combat disorders and other issues related to depression and anxiety. In addition to being a psychotherapeutic instrument, gratitude is considered essential for forming the personality and character of an individual. So once again, how we can culture and train our brain just as we train our muscles in a gym. So the last thing I want to look at, but it's far not the only thing. There are lots of other things you could look at. But the last thing I'm going to bring up for this presentation is around compassion. And James Kirby said that compassion is defined as what we feel, our emotional response rather than a cognitive response, when we recognize the suffering in another and have an authentic wish to relieve this suffering. So some people also talk about a compassionate instinct, that it's not just a learned response. And some of the studies supporting this is that you can see a helping behavior and neurophysiology of rats. But also if you look at little infants that are too young to have learned, how you should be polite, you can see behavioral and pupil responses in them that shows that they also have compassion. So why is compassion important? Sekola et al. Said that compassion is essential for social connections. Fredrickson said that it's linked to lower levels of inflammation. It's linked to longer life. And to quote the Dalai Lama, love and compassion are necessities, not luxuries. Without them, humanity cannot survive. So I'm now going to go into something more particular, which is self-compassion. And this is Kristin Neff. And Kristin Neff was similar to myself. She's a medical doctor who also had a mindfulness meditation practice that she did on the side of her medical practitioner, that she found was very, very helpful for herself. But she then managed to do two things. One was that she defined what is self-compassion. And then she developed a scale for how to measure it. And after that, it's been rampant. There are more than 1,800 articles on self-compassion. There's so much, and there's more coming every day. So what she said is that there are three aspects of self-compassion. And it's similar to the compassion you have to people. If you see someone on the street, you first need to notice them for you to feel compassion towards them. The other thing is you need to notice them with kindness. If you just see someone on the street asking for help and you feel annoyed, there's no compassion there. And then there needs to be a connection to our common humanity and a wish to alleviate that suffering. So she says that's the same if you can apply to yourself. So first you need to see that you are suffering. You need to notice that right now I'm suffering. And you need to notice it with kindness. Many times when we suffer, we tend to be angry or upset with ourselves. We think we should be better or know better or feel better. And then there's important that you connect to a common humanity. So instead of saying, why me? Why am I the only one suffering? It's connecting to the sense that just like me, so many other people are suffering in a similar way. And those are the three aspects then of self-compassion. So once again, what is the impact of self-compassion on self-reported symptoms? So here is a meta-analysis by Macbeth and Gumley from 2012. And they looked at 20 studies and found a large effect size between self-compassion and depression, anxiety, and stress. Allen and Leary, 2013, they found that self-compassion predicts positive responses to the aging process in the elderly. So very good for our elderly population. And Costa and Wren, they found that it can be a buffer against negative outcomes in those with chronic pain. And also, Bryan et al. Found that self-compassion protects against the emotional impact of illness in people infected with HIV, and is related to lower stress, anxiety, and shame. Once again, very relevant in our context. So how does self-compassion affect biomarkers? In one study, they could see that self-compassion training not only changed anxiety and cardiac responses in a stress relation, but it also decreased the body's stress activation as measured by alpha amylase, which is an enzyme in the saliva. And Brains et al. Found that a comparison of a stress-induced inflammation marker, interleukin-6 in the blood in 41 healthy adults after exposure to a standard laboratory stressor, and they find higher levels of safe compassion had significant lower levels of inflammation markers. And then it could even see that self-compassion has been related to stopping or reducing tobacco use and reducing alcohol use. It also has behavioral impacts. So what are the common myths about self-compassion? So many people, when you talk about self-compassion, they think that it's a sign of weakness to have compassion with yourself. But actually studies show that it's the other way around. So there was a study on veterans coming back from Iraq and Afghanistan. And they found that the higher they scored on the self-compassion, the less risk they had of developing PTSD. And this correlation was even stronger than combat exposure. So self-compassion makes us more resilient. The other common myth is that self-compassion destroys motivation. Many people are afraid, if I'm too kind with myself, will I really then push myself to achieve? But once again, here research, and this is one study, but there's lots of studies that show the same thing. It actually shows the opposite. So there was one UC Berkeley study where they gave students a vocabulary test, which is one of those tests that everybody fails, basically. And they gave half the group of students were supported in how to be self-compassionate towards themselves if they failed, while the other ones received a self-esteem boost, which basically was like, well, you managed to get into Berkeley, so you can't be so, you're quite brainy, so I'm sure you'll manage. And what they found was that the students who received self-compassion intervention, they studied longer and harder for the retest. So basically, if you're not so hard on yourself, if you're not so afraid of failing, it makes you more able to actually put yourself out there and put in more effort. Another common misconception about self-compassion is that self-compassion is indulgent, you know, like if you feel too much compassion towards yourself, you will just eat sugar all day and lie on the sofa and watch Netflix. But that's not the case. It's similar to if you're a mom and you have, or you're a parent and you have kids. That's not what you do to your kids when you're compassionate. That's what you do to your kids when you're lazy. If you're a compassionate parent, then you make sure that they are healthy and well kept, taken care of. And that's the same with self-compassion. It makes us take care of ourselves, not just indulge. And the final one is that self-compassion is selfish or narcissistic. We are just looking at ourselves. And that's similar. Many people think that mindfulness practice is also a self-indulgent, something for people with lots of time and money, basically. But what you find is that the people who do engage in self-compassion and mindfulness, they actually become more supportive partners. So here was a study on 100 couples, and they had each couple fill out the self-compassion scale, and then they allowed the partner to rate each other's on how they related in the relationship. And they found that those who scaled high on self-compassion scale were described as more caring, capable of intimacy, and less controlling, and got angry less often. So finally, I'd like to look at healthcare providers, and that's where we are today. We are in a group of healthcare providers. What you can see is that clients of meditating therapists get better faster than clients of their non-meditating counterparts, even when the clients are unaware of their clinician's personal mindfulness practice. Another study found that primary care providers with high levels of mindfulness scored higher on patient-centered communication, used a more positive emotional tone with patients, and received higher overall patient satisfaction scores. And finally, and this one is the one I think is the most relevant, physicians who were taught a modified mindfulness program of only 18 hours showed reductions in burnout, depression, anxiety, and stress, as well as an increase in their sense of personal accomplishments. These changes persisted 9 months post-intervention. So I think this is one of the reasons why I wanted to also share all of these studies, because I think in a Zimbabwean context, we have a great tendency to become overwhelmed as healthcare workers. And if we can start by caring for ourselves through both mindfulness, gratitude, and self-compassion, then that can also support us to be more supportive towards our patients. And I think the final thing that I'll mention, and it's not here on the slides, but because I'm sure many of you might think, you know, like these are all Western studies, you know, how does this apply in our context? So the organization I'm working for, Shandiri, we work with peer-to-peer counseling for HIV positive adolescents. We have recently integrated something called Wakakosha, which is a intervention focusing on self-stigma through inquiry-based stress reduction. And this inquiry-based stress reduction also has elements of both gratitude, self-compassion, and mindfulness. And we find that it's not only very acceptable, like the young people really take into it and they love it, but it's also very helpful to them, both with self-stigma and general well-being. So just as a conclusion, what we have seen in my organization is that it's very culturally appropriate, and also it's accessible, as I said, in a health system where we have very few psychiatrists and very few clinical psychologists. We need to look at other interventions that can improve mental health. So finally, and anyone who wants a copy of this presentation is more than welcome to contact me. I will share it. Here are some resources that I'd like to recommend. One is, as I said, I did this mindfulness meditation teacher training course. The teachers for that one, Tara Brack and Jack Cornfield, they provide a 7-week Power of Awareness online course, which is really good. It costs about $200, but then you have it basically. There are also one is called Happier App, Headspace, Sharing Mindfulness, self-compassion. All of these are resources where you can get more information and more support in exploring this yourself if you're interested. In the Sharing Mindfulness, there's a book specifically on how you can set up mindfulness groups within a health facility, and a mindfulness course within a health facility. And finally, if anyone would be interested in setting up a mindfulness group for healthcare workers, then we are a few, at least in my network, there are a few trained mindfulness teachers. If you contact me, I can do my best to link you up with either myself or someone else who can provide a 4 or 6 week course where you meet once a week and you can explore mindfulness and self-compassion. So I think that's all for me. I know I've taken a bit less time than I was supposed to, but this gives us more time for questions. So if anyone has any comments or questions, then please feel free to chime in.
And just as part of the rules, if you have a question, please unmute yourself, give your question, and then mute yourself. I'll just go ahead, Dr. Sahlberg, and I'll just say, what inspired you to focus on mindfulness, compassion, and gratitude as an area of study?
I would say that it's my own personal practice. So I started 2009 to do mindfulness and self-compassion and gratitude, and it had an immense impact on myself. And then I became more curious about the research behind it. And I think especially for clinicians, we need research in what we do. It's not just personal experience. So that's why and it's also, it's quite, it's not so easy to get an overview because there's so much out there, and many of them you have to pay to get the articles. I just thought it might be helpful to get an overview of what's out there.
Okay, and based on your research so far, what would you say are, what would you consider are like the biggest barriers now implementing these interventions in, let's say, clinical or community settings?
What's the greatest barriers?
Yeah.
I think we just need to, I mean, as I said, like the Waka Kosha intervention that we developed here, the first thing is we need to localize so that we have a localized package. We shouldn't have Western packages. The Waka Kosha intervention is a localized package that we developed together with Beyond Stigma, which is an Irish organization. And we have so much interest, not just within Zimbabwe, but within the region. We have several countries who have reached out and want to have a similar for adolescents living with HIV. And that's basically focusing on self-stigma. So it's a good way to sort of get introduction towards these practices. So I would say the biggest thing is really to get a local package and then to start doing studies around it and start to see how it works within our local context.
Good evening, Dr. Sahlberg. Thank you for the presentation. I just wanted to ask, in your presentation, you mentioned how mindfulness is effective in significantly reducing suicide ideation. In Namibia, suicide is one of the largest causes of death. Even one of the largest in Africa, their rates here. So I just wanted to know, from your insight with mindfulness, how would you apply it to combat suicide ideation in women or men?
I would say that just going back to what I was presenting, the first and foremost thing is for a clinical practitioner to be aware of mindfulness. And as you could see from the studies, you actually see better outcomes among patients when the clinical practitioner who sees them has a strong practice of mindfulness. The second thing I would say is that we need to make sure that we have accessible programs. So, for example, in Africa, we don't have many clinical psychologists, and just doing one-on-one therapy is not very cost-effective. But we can set up mindfulness groups and workshops for our patients. In that way, it becomes more accessible to people. And how it works, I mean, it's similar to what I was saying before. It's about if you're thinking less, if you're ruminating less, if you bring yourself back to the present moment and you do it with self-compassion and kindness, and that creates a much nicer internal environment for the patient with depression, and that helps them to heal and helps them to do better.
Thank you.
I hope that answered your question.
Yes, it did. And I have just one more. You were speaking of self-compassion. And you also spoke of how it is effective as a healthcare professional to have that with ourselves. I wanted to know from your perspective how a healthcare professional can combat compassion fatigue, because you are dealing with patients a lot of the time, and you are taught to be empathetic, and that you also have your own battery. So when that battery is drained, how does one now navigate? Because you are also feeling underwhelmed or overwhelmed at points.
I mean, thanks for raising that, because I think that's basically what this presentation is about. Like both mindfulness, gratitude, and self-compassion are ways that we reload our batteries. And that makes us more able to not develop compassion fatigue. But also if we do develop it, that's a way to care for ourselves.
Yes,
and I can say personally, that's what I'm using myself. Like when I feel like I'm deflated or not have much left, that's a sign that I need to sit down with myself and care for myself. And then I have these beautiful techniques that I can do it with. And many people might think that, I mean, like you can think that a way of caring for yourself could be like going towards a beach or I mean, we have lots of different ways, but for me, I found that one of the best ways is really to do the self-compassion and the mindfulness. And as I said, there's quite a lot of research that's supporting that also.
Thank you, Dr. Salberg. We have a question from the chat from, I think it's Mr. and Mrs. Betta. The question is mindfulness the same as meditation?
Very good question, thank you. And no, I would say mindfulness is an aspect of meditation. You can practice mindfulness through meditation, but you can also practice mindfulness in everyday life. So just to give an example, you can sit down in meditation and you focus on your breath, for example, the breath coming in and the breath coming out. And whenever your mind goes away and you start thinking about lunch or dinner or what someone said to you or what you're going to do, you just bring your awareness back to the breath. That's, for example, how you meditate. But you can also be mindful in your normal life. And the way that can be is, for example, when you do the dishes, that you really focus on the sensation of water against your hand, or you focus on the sensation of having the plate in your finger, like the contact, instead of just thinking about all other things that we may do when we do our dishes. You're really present in the present moment. So mindfulness can be practiced within meditation, but it can also be practiced outside of meditation.
Yes, Dr. Salberg, I'd like to know, do you think there are interventions that may not be effective or potentially considered counterproductive to people?
Can you come again?
Say, would you say there are individuals or conditions for whom like mindfulness or compassion or gratitude interventions may not be effective or be considered counterproductive? Because everyone's different, not everyone tends to subscribe to the same.
Yeah.
Kind of
thanks for that question. I definitely think it's a personal basis. Some people are drawn towards it, some people are not, but even people who are not drawn towards it, what I found, and also many others have found, is that it's actually more accessible than we think. I think there's one group in particular that we need to be careful with, and that's people who suffer from trauma. And what's been seen in research is if you have trauma, usually the trauma is held in the body. And if you then do, for example, a breathing exercise and someone connects that to a trauma, that can be just like re-traumatizing them. It doesn't mean you shouldn't do mindfulness, you have trauma, but you need to have someone who knows how to introduce it in a safe way so that they're not being re-traumatized. So I would say the ones who are suffering from trauma, you need to have someone who knows what they're doing when they're introducing mindfulness, or introduce it with care.
Okay. So you sort of, because my next question was then, but I think you've just answered it here, because I was curious as to whether or not like there are particular populations or groups, maybe children, elderly, individuals with PTSD, that benefit more from these practices than others. And I think you might have answered that.
Yeah, I mean, once again, my experience, but also lots of others, it's very accessible to children. Like there is a specific program where you social, ethical, and emotional learning, which was developed by an American university. And they found that introducing these in classrooms, where basically children are taught like how to do meditation, how to check in, share their emotions, how to be gratitude. I mean, all of those things. It's very accessible to kids. And it's instead of just teaching things for the future, teaching them how to do life, how to care for themselves, how to be a better ally to themselves and to others. Also elderly, as you could see from many of these studies, they also covered elderly, the ones with loneliness. So sometimes we tend to think that if you're old, it's like it's too late to do interventions, but both when it comes to psychotherapy and to meditation, it's very useful also for elderly. Is there one population? I think younger people are easier because they're more open. I mean, as I said, also within our organization, the young people are really taken up to this. And of course, people who are older will always have more resistance before they try something new.
Okay, and I did, in your presentation, you mentioned how some people, when they share images of gratitude, it's sort of like probably influences or changes their approach or appeal for life, for lack of a better phrase. Do you think any other forms of technology, especially for the youth, that can be used in advancing this mindfulness and gratitude practices other than social media?
I mean, just to see like the Headspace and Happier app, these are apps that are, I didn't mention this, but there are also studies that show, and I think this is quite interesting, like we have generally we have a set point. Someone might be a quite unhappy person, they win the lottery, after a year you can see that they are still unhappy. You might have another person who is a quite happy person who gets quadriplegic, they get really sad, but after a year they have a similar satisfaction of life that they did before the accident. So we have this sort of internal set point, which is unaffected by external events. But they've seen that you can affect this with the mindfulness meditation, and that you became 10% more happier. So that's the background towards this 10% Happier app. So both the Happier app and Headspace are basically like apps with lots of guided meditations and other things that you do to explore this, and very youth-friendly.
Thank you so much.
I think also within our organization, with our Raka Kosha program, we're also developing an app connected to that to make sure that it has wider spread and is adapted to the local context.
Thank you so much for that. Do we have any further questions from the group? Any questions in the chat? Please feel free to state. And if you want to ask a question, you can unmute yourself and just put it to the floor. We do have, thank you. We have a lot of praise for your presentation in the chat, Dr. Selberg.
Thank you, and thanks for your attention. And hope you find this useful.
Yes, for sure. Any questions from any of the delegates? Okay. And I'll just have one. How do you think we can sustain these practices over time? Because I do believe, like, the saying that human beings are like helical, they're like helical models. You change from one point to the next. So sometimes you're fine, sometimes you think you have that program or that method in how to deal with your emotions. Things happen. Sometimes you lose yourself, sometimes you find yourself. So how do you sustain this?
I think the most important thing is to have a community of practice. So let's say that you introduce like mindfulness within a health setting. Make sure that you have a group, and maybe even set aside time, like every week on a Friday afternoon, that people can meet and they meditate together. And if people support each other, then you don't tend to fall off as easily, because if you do, you talk to someone else and then that motivates you to keep going. So I would say that's one of the most important part. The other one is the aspect of self-compassion. They've actually seen that if you have self-compassion, you have more tendency to keep doing your practice of meditation than if you don't have self-compassion. So self-compassion also helps us to be kind to ourselves if we fall off the boat, you know. So yeah, I would say having a community of practice and self-compassion are the two most important things to keep going. Because it's similar to being in the gym. You need to keep doing the practice, even though you can see ongoing effect, you know, from the studies from an 8-week course. The more you do it, the more impact do you have.
Yeah, but I feel like it's easier when you see results than it's state of mind kind of thing, because our emotions, just keep.
And I think also, like you see in these studies, it doesn't take too much time to see results. Like some of the studies, it's only 4-week courses, and already after that, you see impacts on both like how people feel, but also like on biomarkers and how our brain is wired. And that's also my personal experience. It doesn't take long to find impact of this.
Dr. Salberg, I just want to ask one last question. A key technique to switch off in terms of not ruminating, what would you suggest that would be? I saw you mention body scanning. In the presentation, you also just mentioned washing dishes and trying to be present. So for someone who struggles to be present and the thoughts keep coming, what would you suggest they can do to just switch off?
I mean, one of the things that's really helpful is just, for example, if you're sitting on a chair, to feel your feet on the ground. And if you have your hands on your lap, you know, feel the contact of your hands on your lap. You can even feel your bum on the seat. Like start by just grounding yourself by feeling the contact, you know. And then just like you're saying, the body scan, that's a really helpful approach. I mean, you can, for example, just connect. Breath is also an important thing. Just feel your breath, maybe 3 breaths. If you're in your rumination, just sit down, contact the ground, close your eyes, and just do 3 breaths where you just keep your mind towards the breath. I'm even tempted to say, try it out now while we're sitting here.
Thank you.
But if you're also, there's so many guided meditations online, and they're not lengthy. Like you can do a guided meditation with body scan just to try it out, because they are very helpful. Also for if you have difficulty sleeping, you know, like body scans, or people are stressed, you know, it's a very good way to calm down and relax.
Okay, we don't have any further questions, but we do have comments. Roland would like to say, thank you very much for the relevant presentation. Gratitude opens many doors and also softens judgment. We also have a comment from Oba Kang, who says, evening doctor, very necessary approach and practice and topic, gratifying that practical local solutions are being practiced as well. I'll just give it to the floor one more time. Are there any further questions or comments that you'd like to share before we close off in timely fashion today?
Sorry, was that for me? If I have any final comments?
It's first for the floor. But if you do have any final closing statements that you'd like to make, given that no one is saying anything, if you have any closing statements, feel free to make them.
Well, maybe just to thank everyone for your attention and for the discussion and for your interest. And as I said, if anyone wants to know more about what's available in Zimbabwe, then please feel free to contact me and I'll link you up to whatever I have in my network.
And following that, thank you once again, Dr. Salberg, for making time for this. We've been communicating, I think, rigorously over the past 2 weeks. I'm really glad that you opened your schedule to give this presentation today. I would like to thank everybody as well this evening for making time to show up, also have your inquiries answered. Once again, the register has been posted in the chat. It's the final time, and it will close automatically at 7:30. Please just mind you that certificates are delivered within a 1-week window. If you have not received a certificate, kindly email icnam@intellectuscampus.com. And on behalf of Intellectus Campus, thank you so much once again for just making this one of these like interactive, knowledgeable exchanges between us and professionals. We hope we continue this, and I hope to see everybody next week again. Thank you so much. We'll close this session automatically at 7:30. If you want to leave your comments, fair enough. If you'd like to go, thank you so much.
Good evening. How do I sign the register? The attendance register.
नमस्कार